Good evening, guys. Today we'll be talking about the Ottowa ankle rules. Uh, so now we start off with why the rules were made. So what happened was, in a lot of situations in the accident and emergency department, whoever came with an ankle twisting injury, whether it was mild or severe, was being subjected to X-rays. So what some smart people did was they were like, okay, let's go in hindsight and create a set of rules so that everyone in the emergency department doesn't have to undergo X-rays. And so what happened was 15% of patients out of the 100% that were scanned only had ankle fractures. So in the remaining 85% of patients, they had no evidence of any bony injuries. So the X-rays were wasted on them. Not only were they unnecessarily exposed to radiation, in case of any triage events, they occupied space in the X-ray room when it was not required. Uh, they cost them extra money because X-rays do cost money and a lot of things. So that's why these rules were made. Coming to rule number one. So this has only Ottowa ankle rules are basically just two rules. The first thing you have to ask the patient to do is, were they able to weight bear after the trauma or the incident or the twisting injury or the accident? Were they able to weight bear immediately and walk on the suspected limb? If they were able to, that's good. Next, when they do turn up in the A&D department, you ask them to walk for 4 steps. Even if it's slightly painful, it's okay. If they can cleanly walk 4 steps, that rules out the need for any radiological investigations. Then after that, what you do is you subject them to a bit of palpation. What you start with is you look for tenderness at 4 points. Lateral malleolus, tip and the posterior border 6 centimeters. Medial malleolus, tip and the posterior border 6 centimeters. The base of the fifth metatarsal and the navicular bone. So the lateral malleolus will be the most prominent point on the outer aspect of the ankle. You palpate the tip and then you go up through the posterior border 6 centimeters upwards roughly. You go on pressing and you check. Then for the base of the fifth metatarsal, which is also on the outer aspect of the foot, you take the pinky toe, you palpate on the outer border of the pinky toe all the way up, and you'll feel a bony prominence. That will be the base of the fifth metatarsal. The other two bony points, the medial malleolus and the navicular tuberosity. So the most prominent bony point near the ankle on the inside of the foot is the medial malleolus. You palpate the tip of the medial malleolus and you go on palpating the posterior border 6 centimeters from the tip upwards. And then you come 2.5 centimeters anterior, 2.5 centimeters inferior to that point. You will palpate a bony prominence called the navicular tuberosity. So that's on the navicular bone. So you palpate over the navicular bone. And if there's no tenderness on all of these 4 points and the patient is able to weight bear, then you can immediately suspect an ankle sprain or any other soft tissue injuries because there is no bony injury and there's no need for any radiological investigations. There's no need for X-rays to be done. This is basically a chart summarizing the Ottowa ankle rules, which says the same thing. So as you can see, this test has us, the Ottowa ankle rules have a sensitivity of 97%, which means they are really, really good at ruling out ankle fractures. And if you follow the rules correctly, in 97% of cases, you don't need to subject the patient to the X-ray, and they're true negative 97% of the times. They can tell you if there's no fracture in 97% of cases. So why are these rules important? So imagine you're in a situation where you're away from the hospital, like let's say you're trekking somewhere or you're on a beach, you're on some desert island, somewhere far, and someone undergoes a twisting injury of the ankle. You can apply these rules, and if the rules are negative and you suspect no fracture according to the Ottowa ankle rules, then you can do some first aid, put like a crepe bandage, and you can make the patient weight bear and walk. And you can probably get out of the situation just fine. Whereas if the Ottowa ankle rules are positive and the patient cannot walk, they might have to be airlifted and they might probably have a fracture, so they might have to be airlifted or some kind of vehicular transportation is necessary because they will not be able to walk very far and they will need x-rays. So that is why these rules are kind of important. Okay, that'll be all for auto ankle.